Hey cat lovers! Welcome back to Catatious, your one-stop spot for everything feline. If you're tuning in today, chances are something's off with your furry friend. Specifically, they've been peeing blood. It's not something any of us ever want to see, and understandably, it can be pretty alarming. So, let's take a deep breath and break down what's going on, why it's happening, and most importantly, what you should do about it. First things first, if your cat is peeing blood, don't panic, but do take it seriously. Blood in the urine, also known as hematuria, can have several causes, but it's a sign that something isn't right, and it's time to get to the bottom of it. One common cause is urinary tract infections, or UTIs. These can happen when bacteria invade the bladder or urethra. UTIs are painful and can cause your cat to pee more frequently, sometimes with visible blood. So, what should you do? A vet visit is a must. They'll likely run some tests, like a urinalysis, to figure out what's going on and how to treat it. If it's a UTI, antibiotics will often do the trick. But there's more to consider. Your cat might be dealing with bladder stones. These are mineral deposits that form inside the bladder and can cause irritation, discomfort, and yes, blood in the urine. The symptoms of bladder stones can sometimes look like a UTI, so a vet's diagnosis is crucial. Treatment might involve medication, special diets, or in some cases, surgery to remove the stones. Then there's the possibility of something a little more serious, feline lower urinary tract disease, or FELUT. This umbrella term covers a range of issues, from infections to stress-induced bladder inflammation. Cats who are stressed out, especially in multi-cat households or during big changes, can develop a form of FLUTD known as idiopathic cystitis, which leads to blood in the urine. If stress is the culprit, your vet might recommend behavior modification, calming products, or even medication to help your cat feel more at ease. And don't forget about the possibility of feline kidney disease, which can also cause blood in the urine, especially as it progresses. Kidney problems are more common in older cats, and they can lead to a range of symptoms. If you notice other signs like increased thirst, weight loss, or lethargy, it's important to talk to your vet right away for a full checkup. Finally, let's touch on something that's a little rarer but still worth mentioning: bladder cancer. While it's not the first thing on the list, it's still a possibility, especially in older cats. If your cat's bleeding persists, or if other symptoms start showing up, a vet may perform imaging tests like an ultrasound or x-rays to rule out tumors. So what can you do? Start by observing your cat. Are they straining to pee? Are they using the litter box more than usual? Are they having accidents outside the box? Any of these could be signs that something's off. The most important thing, though, is to get them to the vet. Don't wait for the symptoms to go away on their own. Blood in the urine is always a signal that your cat needs professional care. Before we wrap up, remember, your cat's health is your priority. Even though it's easy to feel helpless when they're unwell, being proactive and getting them checked out early can make all the difference. Don't hesitate to take action. Thanks for hanging out with us today on Catatious. If you found this video helpful, give it a thumbs up and subscribe for more content to help you keep your kitty in tip-top shape. And speaking of keeping your cat healthy, we think you'll positively enjoy the video on screen. See you next time.